Well, thanks for still staying with us. This is still our segment, AM Doctor. This is where you get the opportunity to speak to our doctor on call this morning here on the AM show. And as you probably can imagine now, it's an extended version of our program this morning. There's a press briefing. Three things that press briefing will look at: updates on Government of Ghana locally produced PPEs for COVID-19 response, electricity rebates, updates on COVID-19 recoveries and tests. That press conference is coming up this morning. So we're building up to the press conference. When it gets underway, we will take you to the venue. Okay, so that's about to start. We will get Dr. Kama to wrap up with his comments on the questions that came in earlier. Dr. Kama? Okay, we will touch base with Dr. Kama in a bit, but we've received lots of your messages on WhatsApp. Let's read some of the messages that you've sent to us from all over. This one says, could you ask the doctor what is the state of exposure of the ward nurses to this pandemic, and are they considered frontliners? Abu from Damongo asking this question. This one says, I have a friend who's scheduled to visit the doctor in Korlebo. His medicine, and you give a name, is finished and cannot get some to buy. He's very scared and tells me he has started experiencing pains in his body. Ask the doctor for me what he should do. This is a very important question that you asked there. We're going to get doctor to comment on that. This one says, Dr. Kama, what provision is put in place for the patients on routine drugs, i.e. patients on antiretroviral drugs? And then you also go on to say, ask doctor to mention his WhatsApp number again. That's Pfizer Araf in Tamale. We will get that. So we've acknowledged all the comment that you've sent through. Let's take you to the Information Ministry. Let's join the Information Minister, Kojo Ponkroma.
Our last brief for this week. This Thursday morning, there are a number of things we want to address at the minister's press briefing. Earlier this week, we mentioned that the president's directives on electricity to be provided for the general public as part of the relief intervention programs associated with the COVID-19 response program will be outlined this morning to all of us at the briefing today. Minister for Energy, John Peter Mewu, my good friend, is here, and he will give us a presentation on what it means, who the beneficiaries are, and most importantly, how and when you can access it at the various points. We have also been speaking in recent days about the subject of stigmatization and how to assist in toning it down. This morning, we will have a very quick conversation on what more we can do to improve the anti-stigmatization agenda. We've also made some progress with making more facilities available as isolation facilities to help in our COVID-19 response program. You will recall that a number of individuals and organizations sought to provide facilities, which exercise was rejected by some of the local communities. The state has assisted in smoothening that path. I want to give you a few updates on that. And then I will give you some updates on tests, and the kind of data that is coming up as part of our enhanced testing program. So welcome once again. As we start, the National Youth Authority is also embarking on a campaign to ensure that young people also protect themselves and do not end up contracting the virus. You notice that from the data that the Ghana Health Service has been putting out, a good number of people who are contracting the virus are young people here in Ghana. I want to start by inviting Chief Executive Sylvester to join us with a quick update on the NYA campaign on COVID-19. Sly.
Thank you very much, Honorable Minister. Honorable Minister for Energy, colleagues, CEOs, members of the press, thank you very much from the offices of the National Youth Authority. On the 30th of March 2020, the National Youth Authority launched a spirited campaign in an attempt to help the young people and society at large to be able to help in the combating of the pandemic. So far, we've donated PPEs worth over 700,000 to the Ministry of Health in an attempt to help combat the pandemic. Again, we are putting out over 2,000 volunteers into the communities, especially the rural areas, to be able to help the campaign. What we are doing with this is we are going down to the very remotest part of our country with megaphones that can pre-record messages and be played in the communities. We think that the young people are most hit at this time, and as a matter of fact, we are not limiting our campaign to the cities, but we are in touch with the Ministry of Information for approved message that should go to the young people of our country. In touch with the Ministry of Information for approved message that should go to the young people of our country. And we are putting out 500 megaphones that will be used by these volunteers, and also the volunteers are ready to support in the isolation centers that are earmarked for the country. We also are undertaking a baseline study to know how this pandemic is affecting the young people of our country, i.e. job losses, health issues, and many other things that the young people are facing. So the baseline studies are ongoing through our social media handles and our website, so that we can be able to identify those who will be hard hit most in these trying times. And of course, to make informed position on the matter of young people to government for redress. Honorable Minister, we are happy to report that the feedback from communities from our regions and the district is quite impressive. We want to thank the President and the government of Ghana for the support they've given the young people so far. Therefore, we are also prepared that after training the 2,000 young people, we also put together a plan that after COVID-19, skills training and many other things we put before the young people of our country. We thank you this morning for the opportunity. We want to urge the young people to continue to adhere to the protocol put out there, so that we all help to combat this. Those who went to the beach largely are young people, and those who are flouting these regulations or lockdown, partial lockdown, are mostly young people, and we'll continue to urge them to adhere strictly to the protocol put out there and the partial lockdown that is currently being enjoyed. Thank you very much for the opportunity. I'm grateful.
Sly, if not use my sanitizer, please come back. We're also teaching people at home, so please do that. So that's the executive of the National Youth Authority. We thank you, your board, management, and the organization for what you are doing to push public education out there some more. As I mentioned shortly, the minister responsible for energy will outline us what the president's intervention or the government intervention on energy or electricity mean to you at home. Before he does that, however, I want to get one donation out of the way. And that their food products should also be made available to the Social Protection Ministry to assist them as they go about their distribution. Very quickly, let me call on Honorable Deputy Minister for Information, Honorable Pius Enam Hajide. Please join me here. And the representative of Lanti Soil Mill Company, you can join him here. And very quickly, let's do that presentation. And then the Energy Minister will join us as we talk about electricity. When we are done, Ghana has so far done 50,719 tests as at last night. And I'll give you a breakdown of the details of that. Some social distancing, please. So Lanti Soil Mill Company Limited, you are making available PPEs and Lanti products worth 120,000 Ghana cedis. You want your PPEs to go to the Ghana Ambulance Service, and the food items that we are making available to go to the Social Protection Ministry to assist us in this cause. We want to say a big thank you to Lanti for your contribution. Honorable Deputy Minister, I'm sure you can do the bow as you symbolically receive it from them. We are very grateful. This is a 1D1F factory, I'm told? Yes. It's a 1D1F factory. Well, so we are very grateful for your contribution. Thank you very much. You may please, do we have items here to make available? Just one is fine, yes. Thank you very much. Thank you very much, Lanti, for your contribution. You may please resume your seats. Ladies and gentlemen, you recall that His Excellency the President mentioned that electricity was to be provided for free for Lifeline consumers and at a discount for persons in other categories. What does this mean? When does it take effect? How do you access it? Minister for Energy, John Peter Amewu, please join us up here with the details.
Thank you, Minister, for information. My very good friend, for you. The Deputy Minister of Energy, the Chief Executives of the various utility companies here present, Directors of the Ministry, my good friend Sly, the Deputy Minister of Energy, the Chief Executives of the various utility companies here present, Directors of the Ministry, my good friend Sly, Chief Executive of the UFNC, the media, ladies, for the period of April, May, June 2020 to cushion the Ghanaian people against hardships arising from the restrictions of the COVID-19 pandemic. Ladies and gentlemen, by that directive, government would absorb the electricity bills of all Lifeline customers and 50% of the bills of residential of between 0 to 50 kilowatt two lighting bulbs points, a tabletop fridge, and a fan for a limited number of hours. So any consumer that have these appliances using on daily basis can be considered as a Lifeline customer. The COVID-19 presidential relief will positively affect customers differently depending on their customer classification or consumption levels. The ECG Lifeline customer population in Ghana currently it's about 1 million Ghanaian. By the customer population, we are talking about the number of meters, but not the population of people. So we're talking about 1 million meters. In some households, we can have between 10 to 5 people using 1 meter. So you can average the number of people that we're talking about. The access rate today in Ghana is about 86–87%, which means about 86 to 87% of the Ghanaian population have access to the national grid. So this directive by His Excellency the President means that about 85 to 86% of Ghanaians would enjoy this access. The customer population of 1 million of ECG is about 27.4% of the ECG total customer population. This means that at a current tariff level, government is absorbing almost an amount of 8.5 million Ghana cedis per month. For non-lifeline customers, of which 2,780,886 are residential and 1,608 are special load tariff customers, a 50% discount on their electricity bill will translate into 235.4 million Ghana cedis per month. The total relief for ECG customers per month based on the estimated revenue is therefore 244 million Ghana cedis, translating into 732 million Ghana cedis for the 3 months commencing from April, May, and June. For NETCO, a total government relief for all customers is about 47 million Ghana cedis per month, or 141 million Ghana cedis for the 3 month period. This comprises relief of about 10.9 million Ghana cedis per month, or 32.9 million Ghana cedis for 3 months, for a customer population of 569,000 live customers. A percentage representing 60.67% of the total NETCO customers, and 36 million per month, or 108 million for 3 months, for 369,000 non-live customers. Ladies and gentlemen, for VRA, the total government relief is equivalent to 55.5 million Ghana cedis per month, or a total of 166.4 million for 3 months. This comprises the relief for VRA comprises the following: 1, 12 mining customers at 42.4 million per month, or a total of 127.2 million for the 3 months. 2, VALCO, 4.8 million per month, or a total of 14.4 million for the 3 months. And 3, other manufacturing customers such as Aluex, Diamond Cement Limited, Savannah Cement Limited, Enclave Power Limited, of which 7.9 million Ghana cedis per month, or a total of 23.7 million for the 3 months. Ladies and gentlemen, overall, the government is providing a cumulative relief of an amount equivalent to about 1 billion Ghana cedi, approximately covering a customer population of about 4.8 million meters across Ghana for the 3 month period commencing April, May, and June 2020. Thank you.
Honorable Minister, thank you for your presentation. Minister, you also didn't use my hand sanitizer. We're encouraging people at home to wash their hands and to use hand sanitizers and we'll also be disinfecting our podium here every now and then. Minister, thank you. So about 4.8 million meters. About 4.8 million meters. As we get into some more detail, there's a rule of thumb about average how many people use each meter. So we can extrapolate and even find out how many people, individuals, are expected to benefit from that. And we'll take some more questions shortly. So that is a quick brief on what the President's intervention on energy means for us. We'll take your questions on that shortly. You can make a note of them. We'll take them shortly. You will notice as well that today we are not doing translations into other local languages because, as we announced, working with the Bureau of Ghana Languages, this entire event is being translated into 8 other local languages for later playback across media networks. Honorable Minister, I would ask you to help me out. Blue Band is here. I do understand Blue Band has a presentation for the Covid-19 Relief Fund. So I'll crave your indulgence just before we move along to join me. Upfields Brands Ghana Limited. They have Blue Band products to support low-income families. They are sending that to the Ministry of Social Protection. If you may please step forward, the Honorable Minister will receive that on behalf. Are you making a presentation, or this is just a symbolic one? Please, if we have products, let's make them very quick so that we can move along. And while we wait for that, let me give you some quick statistics on testing. You would recall that His Excellency the President mentioned that the imposition of restrictions in Greater Accra and Greater Kumasi was to allow for something to happen. It wasn't just an imposition of restrictions or what they call a lockdown for lockdown's sake. It was to allow for something significant to happen. That significant thing is what we call the enhanced tracing and testing program. We had a target, a primary target of close to about 10,000 persons that we sought to test. As at now, as at last night, as at the latest figures updated by the Ghana Health Service, Ghana's case count, as I'm sure you have read on the website, is 641 positive cases. It comes out of 50,719 tests that have been conducted so far. That is almost 5 times, or about 5 times, the target of tests that we set for ourselves to literally lock down and conduct, to give us an indication of what to do next. So just a quick update this morning. As of last night, 50,719 tests had been done. The data I want to give you is about the rates that are being discovered in the tests. The tests have been in 3 categories. There is the normal surveillance test, which is what ordinarily we would have found if we were still using the old method. Under the normal surveillance test, 13,838 people have been tested under the normal surveillance test. People who suspected they had symptoms, etc., and got in touch with 112 and the phone platforms, or went to their clinicians to be tested. 13,838. 268 of them tested positive. That is a rate of 1.9%. So 1.9% of the people who suspect they are having symptoms tested positive. Then there is the mandatory quarantine, where the state decided that we'll mandatorily quarantine people and test them once they were entering the jurisdiction at a time that our borders were being closed. It was in 2 parts, airport and Tamale. So the Accra Airport and Tamale. At the Accra Airport, we ended up running a total of 2,011 tests. 2,011 tests. 105 of them tested positive. In the end, that's a rate of 5.28% tested positive. In Tamale, we ran 11 tests. 10 were positive. That was 91% of that. Then we had the 3rd level of the enhanced contact tracing and testing. That is where now the public health nurses, immigration, epidemiologists are going out into the communities or the hotspots and are chasing, literally chasing or going or seeking to go ahead of the virus to find it and not wait for it to manifest. We have done a total of 34,859 tests in that enhanced contact tracing and testing category. 258 of them were positive. That is 0.7%. So if you put it together, as at last night, we had done 50,719 tests, and 1.3% of the people we have tested are positive. So it begins to give you a sense that this entire, what you call lockdown that has been done, for the major objective of literally trying to get ahead and find out how much of the virus we have in the system and deal with it, we are finding out, as at the data from last night, that just about 1.3% of the at-risk populations that we have tested are the ones that have tested positive. It begins to give you an idea of the level of challenge we have in the system. As we have mentioned, it is elements like this that would inform the president's decision of what should happen next. But in the full interest of transparency, as we provide a lot more information, I've been instructed to make this information available to you currently. We're also informed from the data platforms that 83 persons have recovered currently, and there are some 17 more that they intend now to also conduct a second test for, and hopefully to add to this category. So that's just by way of information. Can we quickly take the presentation from Upfields Brands Ghana Limited so that the Honorable Minister for Energy will receive it for us, and then we will deal with the subject of stigmatization. Upfields Brands Ghana Limited, it's our understanding that you are making available Blue Band products to support low-income families. These products will be made available to the Ministry of Social Protection so that they include it in the food items that they are making available. On behalf of the government of Ghana and the people of Ghana, we are very grateful to you for your contribution to the national cause. Thank you very much. Honorable Minister, thank you so much. Thank you so much. Honorable Minister, may I ask you please to stay with me? I do understand that Betway Ghana Limited has a check of 150,000 Ghana cedis that they also want to make available. I want to get that out of the way, and then we'll deal with stigmatization. Betway Ghana Limited has for us a check of 150,000 Ghana cedis. We are very grateful to you for your contribution. Have you put the money in the account already, or you are now coming to put it? You have put it in the account already. We are very grateful. We are very grateful. Honorable Minister, thank you so much. Gentlemen, thank you for that presentation. Distinguished guests, ladies and gentlemen, stigma, as we mentioned in our last briefing, has become one of the challenges that we very quickly need to combat. If I may repeat, it is because if the levels of stigma associated with COVID-19 continue, we fear that people may go underground. People who have conditions who need to step forward so that we can diagnose them and treat them, they may go underground. People may not disclose their conditions as they ought to. Communities will continue rejecting offers by well-intended people to make available isolation or potential treatment centers. And so it is important that we build some knowledge about why we need to avoid stigma. This disease is not a death sentence. Unfortunately, we have had 8 persons who had underlying health conditions who have passed on, but it's not a death sentence. People can be assisted with treatment and can recover. Later this morning, we'll invite one gentleman who contracted or who tested positive, who was given supportive treatment by the clinicians here in Ghana, who has tested twice and is negative now and has recovered, has been declared recovered, and has been returned home. He's joining us here this morning to speak to us about why we ought not to stigmatize people like him, and we have to give them and all others support and also make available our facilities in our communities. I would invite him up shortly, but it is my understanding that as part of efforts to make more centers available for treatment, a number of organizations and individuals are offering their facilities, some of which have unfortunately been rejected by local communities.
but the state is beginning to assist some of those who are offering to engage with the local communities to deepen understanding so that we can utilize some of those facilities should it become necessary. It is my understanding that the Ghana Football Association has made a facility available. Initially there were challenges, and those challenges have now been resolved. GFA President Kurt, yes, Kurt is here. Kurt, give me just a moment for us to have our podium sanitized, and then please join us with a quick explanation of what the GFA has offered and how far we've succeeded in coming with dealing with the local community to make it available, as we start with the stigma conversation. Okay.
Good morning. So following the passionate appeal by the President of the land, His Excellency Nana Addo Dankwa Akufo-Addo, asking all Ghanaians to join the fight against our biggest enemy, the Ghana Football Association, led by the Executive Council, thought that regardless of the fact that we've been going through our own, what we call COVID-19, in the period leading to normalization and beyond, we will not sit down aloof, for which reason we decided that we have a special facility in Pram Pram that can house up to 250 people. It is strategically placed. We decided to offer this facility to the use of government as one of the isolation centers to treat our people, our colleagues, our brothers and sisters who live in Pram Pram and its environs. Now, following that singular decision, we decided, together with the support of the Ministry of Health, the government officials, to engage the chief, the elders, and the youth of Pram Pram and its environs. In the last few days, we've gone through that process successfully, and we can confidently say that the facility is ready to be used by the government free of charge to ensure that our brothers and sisters in Pram Pram and its environs are well taken care of. Together, we'll win this battle, and together, we'll bring our football back. Thank you very much.
Kurt, we are grateful to the Ghana Football Association for what you are doing to make this facility available as a potential isolation and treatment center. It is important for local communities to understand and accept such offers because it does a number of things. It protects even the local community, because if somebody is positive, that person can be isolated from the community to prevent potential communal spread and can be assisted with supportive treatment in that facility. It is my understanding that the state security apparatus and other ministries working with the Ghana Football Association are now taking custody of this facility so that in the shortest possible time it can be added to the list of facilities that are being used. Also after engagement with traditional and other leaders in that community. So Kurt, we are very grateful for the leadership and the support of the Ghana Football Association. Now, still dealing with the subject of stigma and the need to improve communal support, I want to invite Mr. Fred Dra. Fred is a Ghanaian like yourself and myself. He'll tell us briefly a bit about himself. Fred contracted the virus or tested positive. Fred, come up. Contracted or tested positive, went through treatment, supportive treatment, first negative test, second negative test, is now been declared recovered and is back home with his family. As we deal with the subject of stigma, briefly, he will speak to us and make a call out to the country. We'll also speak about why it is important for you to stay at home so that you don't end up having to go through the path that he went through before recovery. Fred.
Hi. Please, let me use the one that the doctors gave me. So, okay. Thank you very much. My name is Frederick Kwekudra. I'm married 4 children, 3 boys, 1 girl. In terms of workplace, kindly forgive me, I'll disclose it to the minister for certain reasons, because I've done so many interviews and the outcome is very big. So please forgive me for that aspect. Yes, I was tested positive on the 17th March. That was one fateful Tuesday, 12:15 a.m. to get to Wednesday. I was just lying on bed and I realized that I was feeling feverish and I was finding that my throat was drying within the shortest time. So I called my wife. She gave me some paracetamol, 2 tablets of paracetamol. I took it within the shortest time. I realized that I was feeling warm, and through that God so good, I was able to sleep again. The following day, I decided to go to the hospital. I visited my polyclinic. They did malaria test, BP, sugar, and about 4 tests, but they realized that I was all negative. But they took my temperature. They realized that my temperature was above the normal temperature that every woman is supposed to have. So they started some sort of suspicion. So I was not clear in mind. So they just called me to an isolated place and they asked me to sit over there. I sat there for about 45 minutes. No one was attending to me. So I became furious and I started shouting, "Why do I walk to your own facility to treat me, check on me, and later on just come and dump me over there for some normal period?" I started shouting, and one nurse just approached me and said, "Gentlemen, just have patience. Have patience. Someone will come and attend to you." So I was there when I saw one gentleman putting on the PPE, and he attended to me. He came and he asked me to open my mouth. I opened my mouth and he put a small.
Can you just come for just a little bit so that the
yes. I know my status, so I'm just being very careful. Yeah. Yes, if you've been there, you know what I'm trying to tell you. Yes, I went there and by God's grace I'm back. So I'm very careful about the instructions the doctors give me. Anything to attach, I'm very careful. So this gentleman came in and took in that swab, and later on, I drove myself and I went to the house. The following day, Thursday, I was there and I received a strange call. "Please, are you Mr. Frederick Dra?" I said, "Yes." "You visited the hospital this day?" I said, "Yes, I visited the hospital." The gentleman just said, "Yes, they took your sample and lo and behold, they found out that you are COVID-19 positive or coronavirus positive." In fact, it wasn't easy for me. I was trying to control myself. The doctor called me, the one who called me, and encouraged me that I should just disassociate myself from my family. Let me stay at one place and let me let my wife just attend to me and the rest of the children just go far. I was able to obey him, and since then the children were suspicious, but all the same, my wife was strongly behind me. She helped me, and the gentleman said they will ask for ambulance to come and pick me. I was so eager that the ambulance should come so that I can leave early. That fateful Thursday, the ambulance was not there. Friday, the ambulance was not there. Then Saturday, which was 21st, around 4:35 o'clock p.m., the ambulance came. That's the place where I saw myself dying. I really saw myself dying simply because of the information out there. I also know that, the moment you are being attacked by this virus, within 2-3 days, you are dead and gone. I saw my wife and my children cry seriously. I have never sat in an ambulance before, but that day I sat in an ambulance, and the only thing that I could tell my wife is that I just waved her. It was a very terrible moment for me in my life that particular day. But thank God, what the gentleman, the doctor told me that at times even makes me feel like maybe I'll go and not come back again. He said, "Fred, kindly take some small dress. If you can take some small dress, 2 or 3 dresses, and just go." So, 2 or 3 dresses, that means maybe I will go and, to me, I will go and not come back again. But God so good, I told them that they can send me to any place that they want, but don't send me to Tema. I just don't know why I said that. But this ambulance picked me, and I was just in the ambulance. Wherever the ambulance was going, I didn't even know. I was just in, and this gentleman drove me, and before I realized, I entered to the East District Hospital. That very fateful day, I know there should be distance between myself and the doctors. Me being the first patient to use that facility at the East District Hospital. The doctors were scared of me, the nurses were scared of me, and lo and behold, what I just had said, Fred, this is your room. They just opened the room and I was pushed into the room. I was asked to enter into the room. I entered into that room. In fact, it was a moment of sadness in my life. But two ladies came, one lady and a man came and gave me a number. That Fred, if you... What I just had said, Fred, this is your room. They just opened the room and I was pushed into the room. I was asked to enter into the room. I entered into that room. In fact, it was a moment of sadness in my life. But two ladies came, one lady and a man came and gave me a number. That Fred, if you need anything, these are the numbers you need to call. So that means they will not get closer to me. They will not get closer to me. In fact, the doctors and the nurses at where I went, I will just say, I will give them 95% because they did very well. Very, very well. The psychologist, very good job. The doctors, very good job. In fact, the type of food that I eat over there, I would just say maybe I don't eat that one in my house. But the food was good. It comes on time. In the morning, the food comes on time. In the afternoon, it comes on time. In the evening, it comes on time. The doctors over there was very, very good, and they were able to help me to go through. Yes, I was discharged Sunday. I came home on Sunday. The doctors and the psychologists let me know that I should stay indoors. But after certain interviews that I did, my wife will go to town. The moment she comes in, she will just be crying. So she will not even grant any interview again. She'll just be crying. Why are you crying? When I went there, if the thing is there, they will say it is not there. I can remember I was going to barber my hair. I don't go out. One day I want to go and just barber my hair. I went there, the gentleman just saw me. He just said, and all that is it. But the point is that at times I feel bad because I know my status. You don't know your status. That's why I don't want to get closer to you. Yeah. I know my status that I'm tested negative. 2. What about you? But you are rather scared of me. The stigma over there, my children, I thank God they are strong behind me. They go to town. Some of them don't want to pray with them. But there are some other colleagues, friends, who also try and call and encourage me that I should go ahead. I have a questions over here that I want to answer in my own dialect and about 3 dialects. COVID-19, let me tell you that it's real. COVID-19, coronavirus, it is real. I'm telling every Ghanaian that this virus, it is real. So please, try and obey the lockdown, washing of hands, social distance, all other things that they be saying in the media and so on. Let us try and obey. I don't think every normal human being can be drinking water within the shortest time like that. Within the shortest time that I take water, my throat is dried. So I have to be continuing taking water. COVID-19 is real. Now, when someone is being tested positive, brethren, I thought so, that when I go, maybe 3rd day I'll die. But when I went there, I realized that it's not like that. I went and I'm back. People will also go and they'll be back. So when you're tested positive, please, just go to the health centers so that they can take good care of you. They'll send you wherever you're supposed to go, then you go and come back. COVID-19 and coronavirus and
Ayanukre toro, just to be a gym to say Ayanukre. If you say, baby, I will fa enyano, you not know. Me jitum say be a mini Korea for be but I can't see it with my naked eye to say that it was from this man, it was from this man. So it can happen to anybody. A bit me subiaso. And me I can't joran by the Sierraji, Kabonu Kumata Bronebede. Me do to government upon who but me no home, never go to Igava one anako, no home. Obercrossy, Obanaka, I use sanitizer to a cinche. Magano Hadomio. No winema and no skeba Covid-19 yama vago. Kakane baby a set to buy your money kata grown government la yama sagoa. Kahama on toy, Mano Agbekla Kudomi, Kaka Yehoa them. Me really came of Shaman in Nuashi. Covid-19 Lelani. Me quite TV, me nashi mepi still a year Covid-19. I look coronavirus here, look a year. A moment in a belly here, in your drumo imba. Womi Kenya Fashi, you bomardini genie. Can you national win no trashing more bonyo gine? Me bien to the German bonyo Jimmy, no ko FMI, ye who wale me ye ni me yamimba. Ni han obo to government no ne ke wo fear, no for fe. Ko obey ko ye no ya tun ko mam ya lo na very important. Tashia, just obey the government. Tashia ni ke sebi no ko ye matime no he no for oni bi. Ka ye no ya passion COVID-19 eye. In communities, womeni yo akucho bibi emie, nkanyashi, kenye na mukundaka, ofana nyekala yue. Ejuashi ka okele mo ewie, ni o encourage your more banye femini ekeheba ukpan ne bagbe. Shika bo yue no kela shi onungoru ngoda, obaya no ba keni bi mo ko ete ba. In fact, mo fe ne kele mo ba shi. Nyame ole mi papa do mi, mara kuku do na mi. Ne joalade, mi hana mi be mi anami ajidepo.
You will not be tested positive, then you go and die. You will be tested positive, you go to the place, the doctors are good, the psychologists are good, all of them are good, the government is doing well. When I read of the statistics that is going on, oh, God richly bless you and bless you, the government, for what the good job they are doing. God bless you all. Thank you.
Thank you very much, Fred, for, I'm tempted to say testimony, but for your story, sharing your story with us. Throughout, one of the things that we've tried to do is also to get people who have tested positive to help us demystify it. Fred is one of the few who is willing to step forward and speak up. So Fred, we are very grateful. And he makes the point that it is real. He went through a tough time, but luckily, because he stepped forward, he got help. And today, he's part of the 83 who have recovered because they have tested negative after their supportive treatment. And he's also done the local translations for us. We're going to wrap it up here and take your questions on all of the matters that we've discussed this morning. Before we do, let me sincerely apologize. We were billed to have the minister responsible for trade with us this morning. He's unfortunately unable to join us, but we'll do well to have him at a later date to speak to local production of PPEs. So we'll take your questions now. Please step forward. We'll take them in batches of 2, and then we'll do our best to respond to them. Energy Minister is here with me, so our other colleagues will help us to respond to your questions.
Joseph Akable here. I work with Joy News. I have a number of questions. The first one on the package, the energy relief package. I want to find out when specifically it takes off across the country and how prepaid meter users stand to benefit. We have already received calls from persons who have made purchases since the directive took off, since the directive was announced, and they say that they've not observed anything different from what they are used to. And I'm asking because he said it's for the month of April, May, and June. The second question is what happens to persons who may have been taken off the power grid because of their indebtedness to either ECG or NEDCO prior to the directive being announced.
Persons who have already been disconnected because they owe light bills.
They owe light bills, yes. And what's the plan to minimize the impact on an already debt-distressed energy sector? Over the months prior to the pandemic, we had heard from Gridco, the IPPs, and others complaining about financial challenges. And this one goes to you on the testing updates that you gave.
Yeah.
What is our current testing capacity in terms of number of kits we have readily available? Elsewhere, they are able to estimate the number of tests they can carry out in a day, if we have a figure for that as well. And finally, what are the guidelines and follow-up system in place for persons like Fred who have recovered fully from the virus? Thank you.
Yes, sir.
You, Bernard Atwata from United Television.
Bernard, you have to step closer so we can hear you.
Okay, all right. Bernard Atwata, UTV. Opening Meka Chigara. Yapasa, you, Ebimama Yatas, the bank partner, Nyaman Kaino, even soon, so say a picky light. Percentage, you know.
When does it start?
Yeah, because
and only question back on
this week, and I prepaid for no so or no private.
And also any question back on
okay. Yeah. And secondly, you pursue you relation ruler blood for instance service for so a play. COVID-19 in CC and they rebuild system ni because because mo BMP na almost mo dwuma be part be hinge on
blood supplies
voluntarily until be to member.
Okay.
The never report is a system outlet near run dry.
Okay.
So we just want to know and then when I refer so I give it to me.
That's it. Yes, sir.
Thank you very much. My name is Salom Amenya. I work with TV3. So my first question is the fact that we know or we've heard that our morgues are congested. So we want to know what is the plan. Are the public allowed to go pick up their bodies and then bury them, do the 25 people per gathering? If they are allowed to do so, are they supposed to seek some permission, and then from who? Beyond that, we've also seen some pictures on social media that claim that a movable or a mobile kind of morgue has been created at Elwak Sports Stadium. I don't know if you can speak to that particular one.
Okay.
Also, the lockdown, when you look at the way it's being carried out now, persons living with HIV or AIDS have complained that they've not been allowed to go for their drugs because even when they show their hospital card, they are not allowed to do so. So I want to know what is the strategy or what kind of help can these people also get? Thank you.
Very well. Kojo?
Yeah, so we've seen on social media that some communities are against certain areas designated as isolation centers. For example, in the central region around Asinfo, so a school residents there blocked roads. What are we doing about such instances?
Okay. Honorable Minister, please join me and let's deal with the first set of questions. When does it kick in? How do prepaid users benefit?
Thank you, colleague Minister. I'll attempt to answer some of the questions, but the chief executives are here also to assist. The directive by His Excellency, if you recollect, was announced on the 9th of April. And the directive was to be implemented. So the implementation process began. But the April customers, if you recollect, it's for 3 months, April, May, and June. By the 9th of April, some people have already purchased, especially the prepaid customers, have already purchased their prepaid. And some people have already bought their postpaid. So the April benefits will be derived in May, the May benefit in June, and the June benefit will be in July. So that is how. So if you already bought a credit in April, you wouldn't see it reflecting But when you move to May, it will reflect in May. Again, don't forget, the baseline for the directive from His Excellency Nana Addo Dankwa Akufo-Addo was to use the March bill. So it is March. So all the Lifeline customers, we're going to use that March bill. The postpaid, we're going to use the March bill. But if on the 9th of April, you are disconnected, you are not enjoying the national grid at the time the announcement is made, and even as I speak, you are not, then automatically there is no way you are benefiting. But if for some reason your disconnection was because you haven't paid your bill and you have made an attempt to pay that bill today, then of course you will be entitled to the benefit. The benefit is for all Ghanaians. Those that are disconnected will not enjoy until they have been, connected or brought back to the national grid.
Impact on a debt-distressed sector. What is the impact of this close to on the sector that is thought to be debt-distressed?
Well, it's a very good question. The utilities are already suffering, but in the midst of these difficulties for utilities, the human lives is very key. His Excellency, the President, if you did recollect, clearly states that as for the economy, we can bring the economy back to life. But for human life, once it is lost, it's difficult to bring it back. So His Excellency understands clearly in his own mind the difficulties of the utilities. But we hope, as a responsible government, where we have brought this economy to, after the passage of this Covid-19, we will be able to bring the utilities back to life. Thank you.
There's a little trick. Either you don't touch the podium, or when you finish, then you use the sanitizer. So there was a question about what happens to persons who are recovered and are discharged, like Fred. So the doctors keep following up on him to keep checking to be sure that he continues to demonstrate the signs of recovery, and that the signs of an infection are no longer present in him. And at some point, he will do, or they will either visit up on him, or he will do a visit at some point. There is a question about the blood service, impact of all of what is going on the blood service and the role of the blood service in this. We will take it, and when the Ghana Health Service officials join us, they can help us respond specifically to that one. Funerals across the country, private funerals across the country, apart from Greater Accra and Greater Kumasi, that have what you call the lockdown. Private funerals across the country fit into the earlier executive instrument, where they can happen with not more than 25 persons. But in Greater Accra, Greater Kumasi, because of the lockdown, that does not apply until that lockdown is amended or lifted, etc. There is a report about a mobile morgue at the Elwak Stadium. The brief I have is that that entire level 2 hospital is a level 2 hospital that has been built by the military at the Elwak Stadium. It comes along with a morgue as part of that hospital. So it is to be used as part of that level 2 emergency hospital that has been put there. Medical services are still supposed to be available across the country, except when they are not critical or not emergency medical services. That means that persons with other conditions, HIV, etc., who require medication and support from medical practitioners, they are supposed to be given access to their hospitals and medical practitioners, because hospitals and health facilities are open in general. We only advise that if it is not a critical matter, then you may want to defer. But what you've mentioned fits within that category. Now, for the communities that, because of limited levels of engagement between the persons who wanted to make facilities available and the communities, some of the communities rejected initially the offer to have isolation centers or treatment centers put there. The state is assisting those who sought to offer some of these facilities to engage the local community, traditional rulers, influential persons, etc., so that we can get deeper cooperation and education. And this morning, I think we've demonstrated what has happened with the GFA one that was initially objected to, which is now, our understanding is that now the process has been smoothened through, and we'll continue to engage with other similar communities. I'll take a next batch of questions. There are a couple that we haven't responded to, but I'll take a next batch as we come to it. So please step forward. I do understand that the LPG Marketing Companies Association of Ghana also have a check of 60,000 cedis that they want to make available to us. LPG, they are in your space. Mr. So you help me, you receive it for me. Yes, sir. Please step up to the microphone. But it's the same squad. Almost. Are there any others? Okay, so I'll take this, then I'll take the questions from the platform, and then we will wrap up. Yes, sir.
All right, so once you mentioned LPG, then let me bring that question, because the MPA has...
It's like you have the questions in your pocket. Eh?
The MPA has come up with some increment, which has actually resulted in a suit against it on LPG. So we want to know, right now that government is reducing utility and the rest, is it the plan of government to reduce that and then increase LPG? If the minister can address that for us, we'll be grateful. And also some workers of specifically Kolebu Teaching Hospital, especially those at the laundry, they have complained that they are the ones in charge of washing the bedsheet, the beddings and the rest. They also move to the wards to remove them, but then they do that without PPEs. They are concerned because they are not told who and who might have used those beddings.
Very well.
They want to.
Very well, very well. Yes, sir.
All right, Honorable Minister, my name is Bismarck Opon, broker journalist. Honorable Minister, I would like to ask, what are the gender and age statistics of the recovered and the dead? Again, what are the specific challenges of the NADMO regarding the distribution of food to the vulnerables? And then the last one, it's a week since the distribution of food started. What has been the measurable impact on the vulnerable and the fight on COVID-19? Thank you.
Good morning once again. I have like 4 questions. So my first question will be to you, Honorable Information Minister. What are the protocols in communicating to individuals who have had their samples already taken? And then what is the turnaround time for getting back the results after these samples have been taken? And I asked a question within this week about the e-learning for the disability. And then, Honorable Energy Minister, you said 80% of Ghana's population are on the national grid. What about the rest who are in the villages who are not on the national grid? Are there any plans or packages for them? Honorable Information Minister, once again, what is the current cumulative testing capacity for our facilities per day? Thank you.
Thank you. Let me take the questions from the platform and then we'll wrap up with it. Yes, sir.
There's a question to President Brown. The question is, so what happened to the one children? Were they all tested? And what were the results? And then there's also one on reports that...
Please speak up into the microphone. We can't hear you well.
Environmental health workers in the eastern region are abandoning bodies overlap.
Are abandoning what? Those are the 2 questions. Okay, so let me take the ones that are very quickly able to deal with, and then I would invite, okay, well, come up, Minister.
Yeah, the first question on the LPG, that slight increase in price that you saw in the papers, it has been withdrawn. The policy of the recirculation model, I think, as you are all aware, was a very novel thing introduced by this government. We have not started implementation. So that amount of money which you saw was supposed to be used, to level out the prices. but the implementation, there was a bit of error. So it has been withdrawn. And I know the case is in court, but I can assure you that it has been withdrawn. It's going back to Cabinet. Cabinet will relook at it, will examine the bill, and then we'll come back to Ghanaians. The other question was on those who are not on the national grid. Unfortunately, there's little we can do. His Excellency's directive was on those who are enjoying the national grid. So there's nothing we can do. But fortunately, and also the good news, is that there's an aggressive program by the current government to increase access to about 90% by the close of 2024. So we hope by then, larger population of this country will be on the national grid. Thank you.
Honorable Minister, very grateful. There was a question about Fred's wife and kids. They tested negative. Also, he mentioned that because, even though he didn't go into details, he mentioned some other nationalities. Because in his line of work, he deals with some other nationalities. He was traced to persons of other nationalities who had earlier tested positive. Now, the e-learning and call center questions that, Kojo, you asked earlier, I think during our earlier briefing this week. Currently, our 311 call center has not been programmed to deal with persons with hearing impairments. But it has been brought to our attention, and we have advised the technical team to quickly see how they can deal with that. In terms of e-learning and distance learning, I spoke to the education minister, who informs me that working with the Ghana Education Service, what they are also seeking to do is that for those who are visually impaired, potential radio programming to provide them a bit of the contact. And those who have other challenges, the Braille versions of the materials that they seek to use may also be made available to them. But they'll provide us some more detail. Indeed, he tells me he has a meeting with them this morning. They'll provide us with some more details on that one. There was a question about protocols for communication. So currently, we've been able to ramp up to do about 50,000 tests as at last night. Indeed, there are still some samples at the labs that they have to quickly process. The priority is to focus on positive cases and quickly isolate them and treat them within the constraints of time and everything else that they have. So usually it takes a bit longer for negative cases to be told that they are negative. But the priority is that focus immediate attention on the positive cases so that we can quickly isolate them and provide them with the treatment. Gender and age statistics for those who are recovering and those who may have passed on, we will get our Ghana Health Service data team to better nuance that data. You know that based on the engagement that we keep having, we continue nuancing the data for our mutual consumption. So we'll engage with them. I think one of the major challenges of the state food distribution effort has been the social distancing challenge, and we've had opportunity to speak about it. The ministries of social protection and local government have issued directives on it, and I suspect that you are beginning to observe a certain improvement in yesterday's photos and videos and monitoring that some of you may have done. That has been one of the major challenges in the distribution of food. In terms of its measurable impact, the idea was to provide some relief or to make it more bearable for our colleagues who are vulnerable and homeless to stay at home. Because if you ask him to stay at home and he's hungry, he wants to get out there on the street and get into some economic activity and then earn a living. So the idea was to make it a bit more bearable. If you juxtapose that with the general feedback that we are getting that largely people are complying except for our usual recalcitrant colleagues, you can begin to gauge that it has contributed positively to some extent. Kolebu laundry workers raising PPE questions. I was listening to your question clearly. Even though you didn't say it, it sounds to me as though the general nurses and doctors themselves now are no longer complaining at Kolebu specific, even though you didn't say so. That's the impression I got. However, it is those in the laundry who are asking questions about whether or not they should also be given PPEs. That's the understanding I have of your question. What it says to me is that at least PPEs have been made available there. The internal distribution is what they need to engage a bit more on. I'm sure, as you've mentioned it here, they are all watching and listening, but we will also, through the Ministry of Health and Ghana Health Service, draw their attention to it. Sometimes the challenge is that the PPEs get there, but the internal distribution, you recall a few weeks ago, we were talking about the fact that in one particular hospital, the feedback we got was that the PPEs were available at ICU, but OPD and emergency were not getting it. The feedback we have now is that that has improved. So we are hoping that as you've raised this also on this platform, and as we engage with Ghana Health Service, they can also make it work some more. We also encourage the managers of health facilities to also educate their staff on the levels of PPEs. Like we say, the PPEs, not everybody uses the same PPE at the same time. So for example, those at pre-triage, or those who are going to pick samples, the driver in the vehicle or somebody else associated with them may not wear coveralls and boots and mask and gloves and even the glass sort of helmet that they wear. They may not all have that. Maybe the one who is picking the actual swab may wear all of that, while the rest just wear the N95 and the gloves. But we need to educate them some more so that even they themselves have an understanding of it. Same applies to those in the medical facilities. The fact that we are saying that even pre-triage must have some PPE, that doesn't necessarily mean that the person at pre-triage is going to have from boots to coveralls to everything as though they were in a theater. I'm sure you understand my point. So again, we encourage the managers of health facilities to assist us with education, people of the laundry, etc., so that they are also managed in their expectation. I think these are responses to the questions that we have here. Owner Resources Company Limited. Owner Resources Company Limited. I understand that you have brought us, well, actually, yes, you brought us a check for 20,000 cedis. We acknowledge it. World of Champions Ministries. You've also brought us a check for 10,000 cedis. We acknowledge it. And then the Association of LPG Distributors. I understand you have a donation to make. The Honorable Minister is here. We would want to have him to receive it. Please step forward quickly. Honorable Minister, please join us and receive that for us. Chief Director of the Ministry, these checks so that we can ferry them to COVID-19 Relief Fund. Ministry Chief Director, checks. Social distancing, please. It's a new term we have to live with. Yes. You have a check of 60,000 Ghana cedis to the COVID-19 Relief Fund. Honorable Minister, you may want to receive the check for us. This is your own industry. So on behalf of the LPG Marketers Association, a check of 60,000 Ghana cedis. We are very, very grateful for your contribution to this national cause at this point in time.
All right.
Thank you. Thank you very much. Thank you very much, gentlemen. You may please resume your seats. Thank you very much, gentlemen. Distinguished guests, ladies and gentlemen, we'll have to draw down the curtain on this morning's very quick brief. And if there are any outstanding matters, we'll deal with them subsequently. Thank you.